Good afternoon, ladies and gentlemen. Welcome back to Yogaphora Conversations. My name is Andreas Spadafora, licensed massage therapist in the state of Missouri, and also the owner of Yogaphora LLC, professional massage therapy and yoga here in Brentwood at the CIBC place. Today is February 27th. It's about 1 p.m. and we are here for what I know it will be a thoughtful and grounded conversation. Yogaphora Conversations is a long-form interview series dedicated to practitioners whose work is serious, disciplined, and rooted in real clinical depth. These are not promotional segments. They are conversations about thinking, about structure, injury, resilience, philosophy, and what shapes the way someone practices. Today, I'm honored to sit with Dr. Christopher Geer. Did I say it right?
You did. You did.
Good. Dr. Geer is a Doctor of Chiropractic and Master of Science in Nutrition and Human Performance, and a certified strength and conditioning specialist. He is a peer-reviewed published author with research focusing on spinal biomechanics, intervertebral disc health, and inflammatory mechanisms in degeneration. He's originally from Stockholm, Sweden, and he is board certified in multiple countries and has worked with active duty military personnel as well as Division I collegiate athletes. He brings together scholarship, clinical precision, athletic experience, and an evidence-based approach to whole person care. So welcome to Yogaphora Conversation, Dr. Geer.
Thank you. Happy to be here.
Okay, so as you know, I am Italian, I'm from Italy, I'm from Europe, southern Italy, and you are from Sweden. So let's begin by talking about your origins, your beginnings, your early life. So what is it like growing up in Sweden?
I think it's a loaded question, but I enjoyed it. I'm biased. It's special memories with that. It was a very healthy upbringing that I thought. With Sweden, it's a little different from the U.S., but very similar in certain aspects too. So everyone wants to think it's polar opposites, and certain areas it is, but a lot of times people are people, and
yes, we share the same biology, right?
Absolutely. So I enjoyed it. I had a very healthy upbringing, and
what age did you move to the U.S.?
We moved back and forth quite a bit because my mother was from the U.S. She moved there to Sweden when she was 13. And then, so I was, and then she met my father, and then we moved back and forth between Texas and Stockholm briefly. And then right before high school, I came to St. Louis. So I did 3 years of high school, college, and then I moved back to Sweden.
Okay.
For a bit, and then eventually came back for grad school.
Wow. So it seems like a very long. So how many years? I mean, you were here when you were in your teenage?
Okay. Yeah.
Okay.
And then moved back. So I've been here a little bit more than half my life now. So it's
okay. Got it. Do you think being raised there shaped how you see health? I mean, you seem like, of course, a master or a model of health as of today. So what about being raised in Sweden? I mean, the idea of people from Sweden for me is tall, beautiful, slender, blue eyes, and blonde.
Sure.
Fantastic, beautiful, good-looking people. So
I think what makes a bigger difference is who you surround yourself with growing up. Because you could be with an unhealthy crowd in any country or a healthy crowd in any country. So I think that makes a big difference. But generally speaking, like in Sweden, it's very balanced with like meals growing up, for example, in the school system, the cafeteria, it's all, like home or like essentially like home cooked meals, essentially a lot of fish, healthy, well-rounded meals, versus what you may see in the cafeterias here. So that's one thing with health. You're outside more. So like with gym classes, you might go out to the park and go ice skating or, in the wintertime, or, play soccer, just like
you play soccer too. Is that a big sport in Sweden as well?
Yeah,
as much as in Italy?
Soccer and hockey are really big. Golfing they're known for too. But I always want to be the odd person out, so I gravitated towards basketball more than anything.
Gotcha. And were you always active as a kid?
I enjoyed being active. Yeah. Yeah, my siblings and I were always rambunctious, running around. So
did your sibling move to the U.S. too, or just you?
Yeah, we all moved. So they're all here. There's 4 of us total, and everyone's here in the U.S. now.
Okay.
Yeah.
What did sports teach you about your body?
I think growing up, you kind of just learn how to like fall, honestly. Like with snowboarding or anything like gymnastics, you learn how to just like absorb forces easier. So, but then you kind of bounce back as a child, but then when you grow up and have it at a little, higher level, you don't take that resilience for granted as much.
Yeah, so I know. You're made out of rubber when you were a youngin'. That's what I tell my 10-year-old boy. Did you ever struggle with injuries growing up?
Not so much growing up. I mean, like sprained ankles and things like that growing up. But I started seeing a chiropractor because I had asthma growing up. So then that helped me through that. That was my first experience with chiropractic. But outside of that, the injuries came later in life, like with a broken wrist, doing snowboarding, doing some tumbling. I was doing this double back tuck and landed on my neck it was on a pad. It was just on the hard floor. But a lot of low back injuries that the chiropractor really helped me out with as well.
You mentioned asthma. So the chiropractor helped you with asthma?
Yeah, it did. It was it didn't fully, cure it, but it definitely made it more reduce that, opened up the airways a lot more and reduced that stress that it was having on the bronchioles and all that. So
very interesting. Because when somebody thinks about chiropractic is more about skeletal system, muscular system, and physical injuries. They don't think about the lungs. They don't think about how the nervous system also has a direct influence on our respiration, etc. Right?
Yeah, absolutely.
And the diaphragm, etc. So, when did you first become curious about how the body works? This is how we go into what inspired you to become a chiropractor.
I think the first thing was I was 13 when I started working out with my father, and then that was the point in my life where I was just infatuated with like bodybuilding magazines. Because I was a smaller kid and I just wanted to put on more size, and it was very.
Is that in the 90s? Yeah. Of Dorian Yates and the Mr. Olympians.
Sure, yeah. And the Arnold Schwarzenegger and everything.
Arnold Schwarzenegger era, yes. Interesting.
So, I just loved it. It was very fascinating to me. So, we would work out together, and so it was a nice bond that we had, getting into the fitness realm and health and all that.
Did you always know that you wanted to work in the healthcare industry? I mean, you could have been a personal trainer, but you wanted to take more of a clinical career, right?
I was a personal trainer for many years. When I was in grad school, I was doing personal training on the side. So I did that for about 6 years or so. But no, I didn't. I had more of a background in sales. I was doing advertising sales in Stockholm. I was coaching gymnastics and cheerleading on the side, just as a kind of a fun hobby. But not that I wanted it to be my profession. But then after a while, I didn't want sales to be my main focus. I felt like something was missing. And then it just made sense with I've always been interested in like health and wellness, fitness, and then I get to work with people. So it just seemed like a natural fit for me eventually to get into chiropractic.
That's pretty cool. So let's talk about now the athlete and your body. So how did being a scholarship athlete shape your discipline? Because of course, personal development and wanting to become more includes, setting up routines and healthy habits.
Right.
So when you're an athlete, in order to perform at your best, you must have some sort of routine or discipline, right? Every single day.
Yeah. I think this is the key for just staying active or healthy in the first place is there was that passion piece where it doesn't feel like work. It's like you just love doing it. So then it's like, I'm going to put in more hours, not because it seems like work. Maybe sometimes it's, you're not as enthusiastic about it as others, but if you really enjoy doing what you're doing, then it's like, it's just fun. I can't wait to get into it some more. So of course you're going to push yourself because it's rewarding in itself. Like, okay, I'm good with this. Let me put more into it and get even better, and then get that, reward system going. So
when you're so young, you're nothing but potential. So recognizing your potential at an early stage is very important. So you develop a sense of ambition, right? You want to put your heart and soul into, reading, studying, which takes quite a bit of a very strong mindset. So what brought you into the world of personal development, wanted to become a high-level professional or doctor?
Well, I guess my father was a medical doctor, and then he became a chiropractor. And it was, so it always seemed I don't know. He was always someone I always looked up to. I thought he was the smartest person ever. I've got a lot of respect for him.
Interesting.
But he would always be encouraging for, put your mind to, if you really want to do something, you just put in the work and it'll work. And if you want to do it, of course. But I think it's interesting now, like looking back at it as a child, when you feel like you have, I don't know, a talent for something. You may think you're like an oddity, and don't think that much of it. But now I can respect and acknowledge it in children now to really pay attention to that, because I think that's so important. You shouldn't take that for granted, because like you said, if it doesn't feel like work for this person, they're going to put way more effort into it than if you found it was just like a tedious task or anything. So find what you're really like happy about, and almost like promote that more. So
but what do you think about the long-lasting effect of motivation? Do you think that motivation itself has a limited time? Like there are periods in your life where you feel demotivated. So what makes you refine that spark, that drive, that passion, that fire within you?
That's a good question. And I think everything goes in phases, whether it's like years, months, or less, and I find myself like that even with exercise, for example. There's phases where I just feel like it's not as enjoyable to go to the gym and do things, and they may last for I don't know how long. But I think we all have this like internal gauge inside where it feels like, okay, I've hit my threshold for when I feel comfortable, and now I feel like I'm in a spot where I'm not comfortable in this conditioned state, so now I got to bounce back.
Yes.
So it's wherever that like bottom is. Sometimes people have to hit rock bottom before they make a change.
Yes.
And sometimes it's very drastic for people. And then if your gauge is just lower, then what's going to make you just recalibrate?
Right.
And do that.
Tony Robbins, one of the main motivational speakers, I don't know if you've heard of him, but he says that one of the two spiritual needs of every human being is personal growth and contribution to others. Right. So once you are at the beginning of climbing the mountain of, you're at the very bottom, you have a 5-year-long degree that you have to study, complete the exams, and essentially become more. You don't just do it. Do you do it just for self-motivation, or you think in your mind it is because I want to serve as many people as I can?
Yeah, it's a good question. I think so. My grandfather was a dentist, and one of the things he really focused on was if you're doing work for others in the healthcare field or like contributing to others, it's like you're just doing good. So I think there's a lot of value in that. At the end of the day, you're contributing. With what you do as well. It's like you're adding to someone's quality of life.
Yes.
And so that's rewarding in itself. And so I feel very grateful being in the position I'm at, just with my line of work, because patients are happy to see me. They know that their quality of life is improving. So it's very rewarding with that. So I just generally enjoy what I'm doing.
Good.
And I feel like I'm adding to their life experience, and you're adding more to the world than when you're taking from it.
Wonderful. I totally second that. I appreciate that. So let's talk about the athlete that you are today, right? When an athlete gets injured, what's happening beyond the physical pain?
Well, I think depending on how hard someone's like pushing themselves, it could be a very mental and emotional thing too. If it's like almost feel like you're chained down with, you can't like, you want your body to be expressed and do these things and perform. No matter what level you're at, and if an injury is keeping you from that, that can be a very like emotionally triggering thing.
Yeah.
So
because now you're injured, you're crippled, and then you cannot express the full potential.
Yeah, you let yourself down, you let your teammates down if you're in a team sport.
Yes.
So yeah, you want to get back on the court of the field, whatever sport you're in.
And so, what separates, in your opinion, high performers from the rest of us, like elite performers to just like laymen?
Well, I think there's a certain amount of like talent that they have that maybe other people really maybe wish that they had. And sometimes people who don't have that God-given ability may train harder than someone there. So, but I think it's a combination of, whether it's, they enjoy doing it more than someone else, they put in more work, and then they have that natural ability too. So I think it's a combination of things.
Right. So you think that to become a high performer, you need to have a combination of genetics plus preparation?
Yeah, I think that there's always that, talk over, is it,
if you could choose your parents, right?
Sure.
The DNA and everything.
Yeah, and you want like ideal situations, but I think, you hear about those one-off situations where people defy the odds and push themselves. So it's inspiring.
Let me ask you, so as of today, we are in 2026 now. So how do you personally stay strong and healthy? And if you still train today, that's still the way that you used to?
Yeah, I mean, I'm in a phase now where I enjoy being in the gym. So it's like, I value being active, and I have a lot of like active hobbies. So if I'm dealing with an injury, which I have been in the past, it's very frustrating when you can't do the things that you want to do, even get through daily life if you're in pain. No, I'll still push myself in the gym, and just taking care of my body, being very balanced with my lifestyle allows me to do that. So I like to practice what I preach. I mean, people come to me with these issues, and if I can't live that myself, I feel like a hypocrite. So
that's right.
Of course, I want to be like the example that they can kind of build off of.
That's awesome. That's the great way to lead, right? From inspiration and invitation rather than from imposition. If you don't do what I tell you to do, you're not going to get those results. That force never really works in human psychology, in my opinion. I'm also a big fan of Dr. David Hawkins, the author of Power versus Force, the hidden determinants of human behavior. And he talks about he has a sublime delineation of what's a level of consciousness coming from force and what is coming from power. When you are in a state of consciousness of acceptance, neutrality, peace, joy, you emanate a different electromagnetic signature that people can actually read, people can feel. Whereas if your predominant emotional state is coming from fear, anger, pride, grief, people can also perceive that too. And you can perceive that too within your own body. The body feels gravitational, feels heavy, feels sluggish. So there is a strong, in human, in my opinion, in our performance, there's a strong component of psychology. I think every athlete should understand and go through a pathway of understanding their own self-worth.
Sure.
Yeah. So
absolutely.
Now let's switch to your industry, right? This is what people want to know. I'm so honored to have an actual chiropractor on my channel. So in simple terms, for someone who's never seen a chiropractor before, what do you actually do?
To keep it simple, it's just help people move better, feel better, and then restore function to where it's like they're having something that they can't do now physically. Let's get them back to doing what they want to do. And I'll do that, hands-on treatments, soft tissue work, if there's, a muscular component, rehab, and give them some guidelines of what can you do outside of the clinic too, so that they can, contribute to their own, improvement. So.
Great. So primarily work on the skeletal system, right? The discs, and of course the nervous system, because the manipulations of the skeletal system will have an effect on the whole, on the branches, on the ramifications of the nervous system, right?
Yeah, absolutely.
What is the biggest misconception about chiropractic care?
Well, I think it's especially with TikTok or Instagram, everyone wants to see those videos of people popping things, or like the doctors of the pop or the crack. And I
don't know if you've ever seen those videos. There's a video of somebody that takes like a hammer and a scalpel and just hits on the scalpel right at the coccyx, right into somebody's butt, just as a chiropractor modality. That's kind of weird, but it's out there.
I've seen a lot of these, and I used to send these to my dad too, and he would get a kick out of it too, with just these bizarre ways you're like, oh my God, what are people thinking? But what was the question?
What's the biggest misconception? So if it's not just that, then what is it?
Yeah. So I think it's like we're just back poppers, but it's really just restoring that normal movement again. So like you said, if there is lack of movement, our body detects like a stress response from that. So if we can get movement back, then it puts your body in a state where you can allow more healing. So remove that kind of blockade on the parasympathetic nervous system. And so it's move better, and restoring normal ways of functioning so you can get back on your feet to doing what you can do.
When someone walks into your office with back pain, for example, where do you begin?
I think start with listening. You want to hear when did this start? What's making it worse? What's their lifestyle like? And what's contributing to this? And then let's do an assessment to see, okay, how are you moving? What kind of compensations have developed over time? And okay, what's the big picture here? So and based on that, then I can put a plan together. Okay, are adjustments the best thing? Should they maybe be referred somewhere else? Are they in my wheelhouse? So I think just listening to them instead of just jumping in right away with, I've got the answers. Let's kind of see what am I dealing with here in the first place. So.
Interesting. Do you look at the spine differently than other providers?
Yeah, as opposed to like a medical doctor or...
Yes.
Yeah, I mean, in some aspects...
For example, I am a massage therapist. My scope of practice is just simply within the soft tissue manipulation, right? So we work on the scale, on the muscles, and a little bit on stretching, and so lightly on tendons and ligaments, and improving range of motion. That's all we can really do. But we can also recognize and read and scan the person's stride or posture, and recognize what the client needs more, release of a certain part of the body, say the front pectoralis or the hip flexors, or vice versa, the back body. So we look at the whole person.
Yeah. No, I would say so. It's like, so even within chiropractic, you develop your own style of assessing and how do I, treat. So yeah, skeletal, muscular, and then even considering the fascial, that connective tissue over everything. How has that like molded itself over time?
Yes.
So doing a lot of movement assessments that I've kind of tweaked over time that gives me the best big picture of, okay, what's going on here? And then even at like that emotional component too, it's like, what's the tissue tone? Is someone like holding on to a lot of stress, and how is that contributing to the presentation? And then what's their lifestyle like? Is that going to make it like, just working against what I'm trying to do with them? So you want to have a full body or full picture of what's going on.
Definitely. This is a question that most people want to be answered by a chiropractor. When you do that quick adjustment, people call it the pop, exactly what we were talking about.
Sure.
What are you actually feeling for?
Well, I'm feeling for the joint play, like how well is that joint moving or not moving? And if it's stuck, then why is it? And then compare that to the other joints throughout, whether it's the neck or the mid back or the low back. And what's contributing to that? Is it just like an anatomical thing? Because sometimes you can have like a bone spur, for example, that could just be locking into place, which is an anatomical fixation. You're not going to break through that. You wouldn't want to. But you're trying to see, okay, is this a joint play thing where it's just like, and this is maybe more technical thing that when I'm teaching chiropractors about this, does it feel like a block of cheese where it gives a little bit, or does it feel like a brick on brick? So that's not what you want. A healthy end play to a joint would feel like that block of cheese where it just kind of gives a little bit. And if I'm not feeling that, then what's going on? And so you compare that to, and just experience too. You get used to what's normal, what's not, and what needs to be moved here.
Is the popping sound important to you? Because if I was your client, I would be looking for that, right? I want to feel that sound to actually have a tangible proof that something has been done. People often release, yes.
Sure. So no, it is a satisfying, like audible thing to listen to, and especially with all the videos out there, that's what people expect.
Yes.
But you don't need to hear it. It's just essentially gas being released from the joint itself. So you don't need to hear that to get, if you're restoring motion and function back, that's the important thing. But I mean, a lot of times it does give you that instant, not the noise itself, but if you're releasing that joint that's stuck, it does give you that like sense of euphoric feeling. So, yeah.
Let's see. Why do some people feel immediate relief from a chiropractor adjustment? And typically, when you do an appointment, it's like 20 minutes, maybe 15 minutes in and out, unless you're doing additional treatments like shock wave, which we will talk about later.
Sure.
But why do people feel some immediate relief?
I mean, it's all case by case, but a lot of the times it's like, someone has like, restore just such stuck segments, and then they have that like, let's say an extreme example, like someone has like an emotional response. It's like, just so locked up with their body. And once, you get that release in the joints, then it's like you release that, I guess that stress on your whole nervous system. So if there's just this blockade of how your mind-body connection's interfered with, if you're able to communicate that or like clear the loop, it can be, you can get emotional response from that sometimes.
Yeah, definitely. Well, we're emotionally driven beings.
Yeah.
And I think people are moved by emotion. We're not robots.
Sure.
So in fact, in my practice and even in the practice of yoga, I can experience within myself and by looking and observing what's around me that most people they tend to accumulate or store or bottle up emotional tension within their tissues. Say, for example, the psoas, the iliopsoas, the major hip flexor. When people are living a stressful life and they're constantly in fight or flight, their posture are a reflection of that. They tend to have that crouched position, and not just because they're sitting all day, they're sedentary working at the office, but because they are coming from a series of chronic stress. That is, it's their perception of stress, whether it's the financial obligations, whether it's the traffic or the inclement weather, or just relationship in general. So, what do you think, in your observation of your clients over the years, how much emotion is involved into somebody's whole alignment?
Yeah, it's a great question. And some people go, really in depth with this too, but just to keep it simple, like these stressors, it's almost impossible not to go through life without stress. That's just part of it. And then you want to minimize that, but the finances, emotion, relationships, it's like all these things. But if you hold on to stress, it's going to show itself into your breathing. That's going to be thrown off. And you can, like you mentioned, the diaphragm too, if that's kind of in spasm mode. It's going to throw off your breathing. It's going to increase the muscle tone too. Change your posture, and then even like slow down digestion. So if you're not able to like digest your foods, get the nutrients out of them as readily as you'd want, and then with sleep too, if you're not able to like repair, right? Stress can have such a big effect, and then ultimately they have pain as like a secondary bystander of all these things adding up. It's going to have an effect. And then they come to my office because their low back's hurting. Well, what's contributing to that? Let's try to remove the stress, like the physical stressor, but then what else is contributing to that? Like, how can we improve breathing? How can we improve posture and work our way backwards?
So in your practice, you would refer people to health coaches or some old personal trainers, somebody that can take a look at the whole general lifestyle.
I think it's very helpful if you see a need that someone needs, like, especially with mental health now. I think it's maybe more than ever. I'm not sure how things were back in the 50s just because I wasn't there.
Right.
But today there's so many stressors, and it's like I feel like there's definitely a need for the mental health professionals out there.
Yep.
And
we have a mental health festival this summer, June 27th at Francis Park. I'll be offering a yoga class and chair massages on my
I love it.
Yeah. Cool. So let's talk about the nervous system and pain. So is pain always coming from where we feel it, or it can be referred pain from other areas?
Yeah, you can always have referred pain. The shoulder's a really big example of that. People can say, like, they point to, it hurts right here.
Right.
And I was like, I understand, but after doing an assessment, it could be from the back part of their shoulder on the teres major or something. Yeah. Referred pain is one thing, like even your sacroiliac joint a lot of the times. That could be the driver, but then you have pain into your glutes instead, and then so forth. So there is a referred pain thing. So that's why just doing a good assessment to see where is it driving from, and kind of instead of just taking that for what it is, okay, it hurts there, let's address that. Let's do an assessment to see, okay, what's driving the pain.
So, why does the stress show up in the body in your opinion? So how, for example, are emotions and posture connected? This is going back to the same questions as I was asking you before, but for me, Yogaphora is the exploration of the emotional states and the personal philosophy and framework of how to live a happier and healthier lifestyle, starting with emotional management. So if we manage well our emotions, I think we can have a healthier body. So in yoga, for example, every time I step on the yoga mat, I zone out from the busyness and the craziness of the city life. For me, is my wellness sanctuary. It is the self-made bubble where I can breathe, where I can stretch, where I can strengthen, where I can work on balance, etc. So, in your opinion, your personal body and observation, and even when you yourself you work out, how do you think that your posture is connected with emotions?
I think emotion, it kind of goes both ways. I think with emotions, they can change your posture. So if someone's, depressed or sad, they're going to hold themselves in a certain position.
Yes.
And I think that posture itself is going to reinforce how you feel. So I think it was a Tony Robbins thing was talking about emotion follows emotion.
Yes.
So, or emotion drives emotion. And it's really just like changing that posture.
It says energy, emotion is energy, emotion.
Yeah.
Right.
That makes sense. So I think both ways. I think the way your state is going to change the way you hold yourself. And I think that holding yourself is going to reinforce how you're feeling. And so kind of break the loop and almost like act as if sometimes to the posture. But.
Absolutely. That helps too. Sometimes all it takes, when you feel sluggish, all it takes is to get up and get out of bed, get out of the couch and just go out and go for a walk. That's all it takes to get a new positive outlook of life itself. That's why you see people jogging at the park or doing whatever, running, biking. What role does sleep play in healing? I often say it's like putting the brain in the dishwasher.
Sure. No, I think it's huge. I mean, that's where the whole repair happens. So if it's like you're breaking down your body in a healthy way with exercise, then you want to give yourself that time to repair it. And if you're under constant stress all the time and you're just breaking your body down and you're not giving yourself that time to repair and offset those stressors, then you're just going to get this accumulation of, more stress and not getting a chance to reset or take the pressure valve off. So I think it's very big. It's
absolutely. And it's nothing better than the feeling of a refreshing sleep in the morning. It's like really being reborn again sometimes. You always have a fresh start once you've had. How many hours of sleep do you recommend? People say 6, some people say 8.
And it changes as we age too. Me personally, it's around between 7 and 8 is what I feel ideal. Children might need more and then we need less. But I think it's case by case as well. I'm not a sleep expert, so I wouldn't quote me on that. That's what we need. But me personally, I know when I function my best, and sometimes it feels like too much sleep can even make it, you perform worse. So I find between 7 and 8 for me personally is where I function the best.
Let's talk now. Let's switch to another pillar of health and wellness, and it is nutrition and lifestyle. So let's talk about food first.
Sure.
So specifically, how does food impact back pain? Because of course, if you are overweight, if you are, I wouldn't say obese or morbidly obese, I don't know how to say it, but definitely has an impact. If you have a big belly, large belly pushing forward, essentially moving the center of gravity forward is going to definitely have a direct impact on your spine. But in your own words, how does food impact back pain?
Well, I think if it's just the gross amount of, if someone has just the weight issue and it's pulling them, I mean, and I'm not, let's say with pregnancies, for example, a very natural and healthy thing, but with that extra weight, that's going to tilt the hips forward, and that puts a lot of pressure on those sacroiliac joints too. So I see a lot of patients with pregnancy, and that we're trying to reduce that amount of pressure. But if someone is overweight and they have a similar just weight issue going on, that can definitely put a lot of pressure on the joints. And now you have more, gravitational, pressure on them. So just from weight perspective, yeah, it can throw things off and more pressure on those joints. But body habitus aside, if you have like poor quality nutrients in, you're not getting the you don't have the bioavailability of the building blocks to repair yourself, then you're not going to function as well. So, healthy oils are a big thing. I feel like, everyone's, so keen on paying attention to sugars, which they should be, but also the quality of oils, because the half-life is so much longer. It's going to take longer to break that down. It's going to stay in your system more than what sugar is. But so you want to, macros, and then even like the sub-nutrients in there, the micros, I think are very important to be aware of and implement.
Right. So, I'm no bodybuilder. I'm no longer a bodybuilder. In my 20s, I used to lift weight heavily to essentially get my external validation and get the beach body. It is no longer the case for me right now. But in my 40s now, I noticed that when I do yoga, I look for signals. I search for signals coming from my body and from my gut. I get those gut feelings that remind me of my overindulgence of the extra glass of wine or the extra slice of pizza. And I noticed that when I overindulge consistently, not only gives me the muffin top, as they call it, the little extra layer of fat, but also impairs the quality of my yoga. I cannot do the twists. I can, the same crunches I do when I do crunches for abdominal don't feel the same. There is something where the visceral fat and just the subcutaneous fat is getting in the way. So if that impacts the quality of my movement, I can only imagine what would be the impact on the spine, right? So what can you say about that? What is the impact?
Yeah, I mean, you want healthy movement, but I think even more importantly from that, because it's just, our nutrients being able to get to the tissues. And if you're not supplying yourself with the healthy nutrients, then, that's going to make more inflammation. And I think inflammation is driving a lot of pain. And then if you have chronic inflammation and these chronic health issues, you really want to pay attention to like the quality of the foods that you're putting in your system.
Yes.
And of course, just like, the visceral fat and all that, it's going to, make you more, you're not going to move as fluidly as if you're leaner. So you want, everyone's unique, but with body habitus and all that, but you'd want to move as freely as you can. If you feel like you're restricted, then let's do something about it. So
good. Well, one thing that I think often in my practice, my own personal yoga practice, is that good health is multifactorial, is multifaceted. It's got several layers. For example, if you look at the body, we have the front plane, we have the side plane, the back plane. And so good health results from the balance of the interaction of all these components, right? So the back muscles need to act and react in accordance to whatever the front muscles are doing, right? To maintain integrity, to maintain balance. And so do the obliques, for example. So when we work out in yoga, and I use yoga because that's my business, Yogaphora, right? But we work out in multiple directions, right? And we also use the breath as a bridge between the mind and the body, and as a way to feed the body with fresh oxygen, with keeping every cell oxygenated. So do you think in your chiropractic experience as a chiropractor, can you tell right away by looking and assessing a client that their lifestyle is getting in the way, their nutrition is getting in the way, and it could be one of the factors why your work is not sticking, is not actually working as well?
Yeah, no,
You know what I'm saying?
Absolutely. And with the intake forms I have with patients, I do want to get some insight into what, they don't have to get like super detailed, but I do want to know like what are their health habits like. So if you have way too much sugar in your system, I mean, that's just, hyperglycemic lifestyle is going to just be very, hard to combat, because it's just going to cause more inflammation on your system. And if you're constantly just adding insult to injury all the time, then, and they want to try to overcome pain, then let's remove the stressor so you don't make it harder on yourself, and we can actually heal. So let's get good things in and avoid the things that are making it harder to do that.
Mm-hmm. Wonderful.
Does that answer your question?
Yes,
Okay.
absolutely. And why do you think so many people struggle with weight, especially in this country?
I've spoken with people on this. I don't think it's so easy to just like, calories in, calories out. I mean, there's a point to that, but that emotional thing we were talking about earlier, that emotional component is, are we stress eating? Is there that emotional connection with food? Early on in practice, I did a lot with weight loss, and I think there's, a big, value in that. People want to feel good and see themselves better too. And I don't want to like body shame or anything like that. Everyone has their own like body habits that they're comfortable with.
Yes.
But, if people want to be leaner, I think there's that emotional piece that they have to look for. The quality of the foods that they're eating, instead of like, you can get macros the same way, but what are the quality of those macros that play a role? And what are some other outside stressors? There's that hormonal piece. Are there hormonal disruptors? Is there a chronic stress that's kicking them out of hormonal dysfunction or homeostasis? So there's a lot of multifactorial things,
Right.
things that.
Well, there is also, as you know, in this country, we have an overabundance of comfort foods. You have
Sure.
a McDonald's and I don't know, a Wendy's at every corner. I don't think that in my country, in Italy, would see so many options of how many frozen pizzas or the things that you can find in supermarkets can be overwhelming. So it is definitely not about the availability of food. It's more about choice. It's more about what we actually choose consciously to put in our body.
Right.
Just like, you have a pack of cigarettes. It tells you that it's unhealthy for you. It's written right there. And people still smoke. So there is something that goes on internally at a level of identity that needs to change, that needs to switch. And so it's more, in my opinion, weight loss can be more an emotional thing than a physical thing, and also has to do with, like you said, choosing your peer group. Remember at the beginning of our conversation, we were talking about, even in Sweden, it's not that everybody is healthy and vibrant and lean. It depending on whoever you choose to hang out with. There's something called the law of conformity. If you hang out with 10 drug addicts, the likelihood you'll become the 11th is very high.
Sure. Yeah.
Yeah. So going back to to inspiring our clientele about how feels great, the great feeling of being vibrant and alive when you can achieve, I wouldn't say a bodybuilder's physique. I'm talking about a healthy balance, a healthy equilibrium. Just like, you look healthy, your body is the business card, is your business card. I want to engage and pay money to somebody that can embody what they're preaching, right?
Sure.
So do you have any other thoughts to add to that?
Yeah, I do. One is, you have to meet people where they're at. You can't force it. And one of the first patients I had in clinic was a gentleman who had diabetes that was just uncontrolled. And he just very nonchalantly said, I'm going to have to amputate my leg because of this diabetes. And I thought, that's crazy. And so you haven't done it yet. And are you wanting to make any changes? And he was so nonchalant about, no, and he was just like calm about that fate and like not wanting to like do anything. So that was a big really interesting experience for me, because me having to like have that choice, if I could spare my leg being amputated, I'd be like, yeah, what can I do? What can I do to remedy that or do anything about it? So I think the same thing with any kind of change, unless they're willing to if they're so uncomfortable with living the way they are, they're not going to make a change. You have to wait for them, essentially. I mean, I don't think anyone can force you to start thinking or feeling differently about something. It's more of like an internal feeling. So I think you have to respect that.
Subjective experience.
Absolutely. So I think the same thing, you have to respect that in other people. Once they're ready to make that change, absolutely, I'll help you out. But I can't force you want to feel better. Of course, I would want to feel better if I were in these situations, potentially. But unless they're uncomfortable enough, they're not going to make that change. So I think just respecting that, once they're ready, I'm here for them. But if, I can only lead by example. And, it's such a big part of my life to be active, like sailing, scuba diving, all these things. And if that inspires someone else to know, like, oh, I can do those things, and maybe I could, what's keeping me from doing that? I hope that inspires someone. But I can't force anyone to live that way.
I'm sure it does. But I have another big question for you. So my practice at Yogaphora, one of the main components, one of the main philosophies, to choose lifestyle change over pills and surgeries. I've had, as you know, I'm also a medical interpreter. I mean, it's all private and confidential information, but I work for an agency where they send me to several clinics and hospitals to interpret the Italian language. So I'm the guy between the doctor and the patient. So I can only observe the exorbitant amount of pills that the average patient, that mean between 40 and 70 years old, that they consume. Like, some patients cannot even remember or count how many pills they're taking. I had one time, this one lady was taking like 17 pills, different pills for different conditions every single day. And she had to be reminded, had somebody to remind her to take the right pill. So what is your personal approach on inspiring people to choose lifestyle change before they go to traditional medicine, which immediately they put you, they point the needle toward choosing surgery, operating, doing the spinal fusions, etc. Tell me about that. This is very interesting.
Yeah, I mean, me personally, it's, I would want to be as conservative as possible, try whatever I can before I go through a surgery. Some people might not, care so much, and then I just want to be that, do that the first step. To me, that sounds crazy, but it's like, it's their life and they can do that. But me personally, I would want to avoid anything like that. And if I had to, rely on a medication to just like, maintain my life, sometimes I think there's a time and place for medication. Sometimes it's, life-saving. But for all these like chronic, health issues that could be avoided, yeah, you'd want to do something about that. At least I would. So again, it's like, unless someone's, how do you inspire someone like that? To me, it goes without saying, you wouldn't want to live a life like that, I would think. But sometimes maybe people don't know that they could, or they just take it for, like, expect that they will need to have medications. I don't know. To me, I didn't grow up that way. And, I was lived in an environment or a culture where that wasn't the norm. So you didn't, what can you do to just live a healthy, balanced lifestyle, and that be the remedy for it. And then if you need like some, medications to like offset some disease, of course, medicine's come a long way. But for me, everyone to just expect, okay, with aging, I need to start adding in all these things because that's normal, I think that sounds crazy to me. So I think just living a lifestyle where I can inspire change by just, okay, you don't need that. That's all right.
I think, it's great to maintain this body in this physical form for as long as possible. We're shooting for longevity. We're trying to stay independent and dignified for the longest time possible. When I teach yoga, for example, some of my classes, I often joke, to get into a warrior 3 or a crane pose, so that eventually you're going to be able to put on your socks standing on one leg and extend your leg like that, and do it on your own without assistance. I think that's one of the greatest benefits. But now I have another question, and I think I want to know about, and I think my audience wants to know about, and that is, what if you, for example, as a chiropractor, you have an opinion, you tell your patient, okay, so I think that you should change your lifestyle, you should come to chiropractor more often, you have to do this, this, and that. That's my opinion, that's my professional opinion. But then you have the same patient going to a surgeon that is recommending, no, we should operate right now. So how do you deal with that friction if it's happened to you?
Well, I think I attract the people who come into my clinic are interested in being a little bit more conservative for it. I'm never going to say, yeah, okay, the surgeon said this, you don't need that. It's like respect whatever they've been told. But from my perspective, I can just give them my recommendation. I can't really comment on, why they would recommend surgery over anything, over conservative efforts, unless it's obvious to me that, yeah, this isn't, this is an emergency situation. You should not do this right now. The surgery is probably the best thing.
Okay.
So, I mean, there is a time and place. If you're like assessing someone's having a stroke, well, yeah, I'm not going to adjust them out of that. Let's send them to the emergency room. Let's do they need some emergency attention. So I think just doing a proper evaluation.
And you're not going to meditate your way out of a stroke, right?
Right. Exactly. So I think just like giving them, I think it's just due diligence and medical, obligation to do an assessment, give them my recommendation, give them alternatives too. Yeah, you could go about it this way. There are some other things you could do. It's your choice. This is what I would recommend, but I'm not, it's ultimately your body, your life, and you make the choice.
I've had in my personal career, countless of people that have told me directly, oh, I don't want to go under a knife. I don't want to go under a knife. I would do anything that I possibly can to avoid going under the knife. For spinal fusions, for example. That's one of the most popular operations that have been given. And so my role, of course, I have limited scope of practice. As a massage therapist, I can only do so much. I can only inspire them by example and provide the best active listening and massage therapy. That's my limitation within what I'm allowed to do. But, I thought that, maybe a chiropractor could have an extra layer of competence, or it's more within his or her scope of practice to tell a client or a patient whether they should or should not do surgery in the moment, right? Or they should wait. They should first fix lifestyle, nutrition, sleep, lose some weight, and maybe cut off medications. Not all medications, but at least see what's going on and work with a holistic practitioner. That's my personal practice.
Yeah. I think when it comes to medications and things, it's outside of my scope to say even like comment on that. I'd be like, if it were, if it was my mother asking me about this, I would say, maybe let's, try this. And it's a case-by-case situation. Like what are they dealing with? It's so unique. But I can't really guide them on what medications they can do. I can just comment on, okay, this is what in my field, this is something I can deal with, and if this is what I recommend. Okay, based on that. So
cool. Yeah. Well, thank you so much. Now let's talk a little bit about a common path that we both share, and that is the path to the bright lights of the United States of America, the land of the free, where the dream is free, but the hustle is sold separately.
Okay.
So what inspired you to move from Sweden to the United States? That's a question everybody asks me. Why did you leave Italy? So why did you leave Sweden?
Well, we moved to Sweden right before high school because my father was a medical doctor, but wanted to go the chiropractic route, and Logan's such a big school here in St. Louis. That's how we ultimately ended up here. So that's why we moved to this region. And
was the transition difficult for you as a young man going back and forth? Because there is a switch in identity. I felt it personally. There is a code switch. You have to turn on two different light switch. I'm in Italy, I'm in the US, and there's intercultural differences. So tell me about if your transition was particularly hard.
The most difficult thing was saying, bye to friends that, you never think that you're going to like see them again. But so that was the most difficult thing, especially growing up where, your friends are so important to your life, so that was the most difficult thing. Everything else you learn how to adapt with, I thought it was, we lived in Texas briefly, and there it almost seemed fake how people were so happy, or I wouldn't say happy, but just like over the top with their mannerisms and things. And I thought it was just like almost like play acting, where it's
Mm-hmm.
so that was kind of crazy with compared to more of just like subdued Scandinavian, composed. So anyway, it was just like things like that. But then you see I don't know. You could also tell like they were genuine at the same time. So I mean,
have you ever felt like an outsider in the U.S.?
I don't think so necessarily because I'm Swedish, or if when I was in Sweden, like being from some U.S. Background.
Mm-hmm.
I think it's more of just like growing up, you feel like an outsider a lot of the times. Just like no matter where you're from, even if you're like lived in the same culture your whole life, I think there's phases of your life where you feel like an outsider, a little unique, maybe not good enough. You're like very self-critical. So I think those things, yeah, you could feel like an outsider.
You don't seem to have too much of an accent like I do. So is that because you spend most of half of your life, I mean, more than half of your life in the US, or is it because you were speaking English already in Sweden, or?
Yeah, Sweden's really good with teaching English growing up. I mean, if you go to Sweden, everyone's going to know English, or 99%. They're very good at English, but you speak Swedish there. But my parents were really adamant about us being multilingual. So my mother would speak English with us growing up, and since she didn't move to Sweden until she was 13, I guess we just like picked up the way she spoke, and then we moved back and forth between Texas and Stockholm. So. The same thing if I'm in Sweden, they don't necessarily think I have this really strong English or American accent. So I'm a chameleon with that.
You gotta be a chameleon for sure. And I do it myself all the time. But with technology now, you can, it's helpful to have WhatsApp and Facebook, and
sure.
I have my double watch. See, it's 9 p.m. in Italy right now.
Okay.
So I know when to call my family. What did you have to learn culturally here? Is there something that is that is unique about living in the U.S.? Like I see, for example, as in my personal life, I see there's a lot of protection of boundaries, privacy, confidentiality, HIPAA laws,
sure,
and also protection of private property, personal space.
Yeah,
there are those intercultural differences. Is there anything that is inherent to your Swedish culture?
It's interesting when I go back now. I try to go back every year. Still see family and friends and everything. And I think one of the interesting things that pops up to me that's most obvious is here in the U.S. I think people learn if they're loud enough, they're going to get attention. And it's just like, and I guess it's just like maybe they learn that from growing up. But here it's like even as adults, you see like, no, I need your attention. And they'll be loud and like, okay, I demand your attention now. And tons of situations. Probably happens more often than you think, and you just kind of like don't even think about it. But in Sweden, if it's like wait your turn, I'm going to treat you like everyone else, and so it's more of like this more social. People take more social responsibility for just the way things are, and like people are more, I think, polite to people in general. Like on the subways or buses, it's just known if there's an elderly person standing up, you're going to give them your seat, and it's just like this. You don't think about that. Here, I don't think that goes through the same filtration system of your thoughts. So just things like that. I don't think it was tough to adapt necessarily. I mean, you just like...
When it comes to identity, Dr. Tony Robbins says, the strongest force that drives the human personality is the need to remain consistent with the way we identify ourselves. So, for example, I'm a naturalized American citizen, but I feel I'm Italian from head to toe, right? So in your personal experience, do you feel more Swedish or American now? And I'm a linguist geek too, so I love languages and cultures.
Yeah. No, I think just staying curious, I think, is when I'm more like, here it's like everyone sees me as like, okay, the guy with the Swedish background.
Yes.
In Sweden, I'm the guy with the American background. So
yes.
You're always like, whatever. So I think I'm proud of both, with things. I think there's the perks, but do I feel more than one than the other? I think it's wherever you're at. I think you want to be like the one-off situation. So maybe here I'll say, yeah, that's what sets me different. And in Sweden, it's like, oh yeah, I'm more of the U.S. background. That's what makes me different. So
Yes.
maybe it depends on where
It
I'm
makes you unique. I think it's a good ego boost in a sense to add a little bit of uniqueness to your practice. I mean, it's served me well in my personal practice. People just want to come and listen to the weird, crazy Italian accent and accent. So I want to ask you, were there hard parts of becoming established here? Like number one, you have to go through immigration. There is an immigration process, right? You have to go green card and then finally taking the naturalization test. But other than that, did you find some obstacles about becoming established in the US?
No, well, for me, since my mother was from the US, we were naturalized, and it was a very easy process. So that wasn't that tough. And in Sweden, same thing. It was just like, I was born there and just, but there was at one point in my life, I was going to be immigrating to Australia. And that was a whole process with like going through that. But
wow, I didn't know that.
So you learn how to jump through hoops on what to do to get, established in wherever you're going. But
yes,
I think more than anything, establishing yourself as a business owner, you have to jump through a lot of hoops on what to do, and I think that if you're coming from, it'd be much different doing that here in the U.S. versus Sweden. So I think just like surrounding yourself with people who can walk you through the steps makes it a lot easier than trying to just like figure it out on your own. So yeah, the same thing. It's like who you're surrounding yourself with makes it a lot easier. So you're not having these like barriers to entry on whatever you're doing. So maybe not so much with like citizenship, but just like establish yourself as a professional. I feel like there's a lot of things that can be very confusing if you don't have the right guidance on it.
Interesting.
Yeah.
Now let's talk about military, because of course I had to do my I was military duty. My military duty in 1998. I had to do it. I didn't have a choice. It was mandatory at the time. It's no longer mandatory, but as soon as I turned 18, I had to choose, what am I going to do? Am I going to university, or am I going to get a job? But first I had to remove this obstacle of doing military service. So what is it for you, approaching the military in the first place, and how did they shape you as an individual, giving you structure and, understanding the linearity of the military time and being told what you do? And so how was it like working with, active duty military members and just the path of being in the field of the military?
Sure. Well, so my cousin just is finishing up that process in Sweden right now. So when you're 18, you do that. And I really wanted to do that, but I was finishing up a high school here, so I didn't have to go through that process. I think it would have been very interesting. And it was funny, today my brother sent me a video of the Crown Princess is going through a lot of that training right now in Sweden. Wow. Because eventually when she takes over as the heir to the throne, she wants to be more familiar with things. So I thought that was very
because
timely.
You still have a kingdom, right? There's a queen, there's a princess.
Yeah, exactly.
Okay.
But so the prime minister has like the president, so to speak. But there's still that that role that needs to be filled. But with the active duty, so I worked at Scott Air Force Base during my internship or preceptorship in chiropractic, and they were very grateful to get the treatment, because they're banging their bodies up, doing a lot of active work, and just being able to give them that relief. It was very rewarding to be able to see how appreciative they were about just being able to function, because that is their livelihood, to be able to move and all that. So if they're in pain and can't do that, and it's crazy how many like medications are just like, all right, everyone like muscle relaxants and painkillers are just like, okay, let that be the first step to doing it. So that was the first like exposure to how prevalent just like medications are to help this like physical issue, So it's like, how about we deal with it,
Well, of course, the primary goal is survival in the context of war, right? So how we can get immediate feedback from the military, and how can we fix the issue in a situation of emergency? And that's why you need the rations of food, and it's just like the very basic needs for survival in order to eventually maybe win a war if you go into war as a military member. But did that environment change how you approach care?
Well, I think it was a great learning experience at that time, for sure. And, I think all of those experiences like train you on how people respond to care and just how to treat people. But no, and a lot of them had certain like body builds that you had to learn how to adapt to and all that. A lot of like muscular people, and how do you treat that population? And so yeah, I think it gives you that experience on how to treat others, and like tweaks your technique and all that. But
so I know that in the military field, there's a lot of discipline involved. There's time management, there's time to do everything. There's everything is scheduled, and then because I did that in Italy, that was the way that we were being shaped. You have to make your bed in a certain way. You have to clean up and polish your suit, your uniform, your shoes, and so having that kind of external feedback was important from your superiors, right?
Sure, yeah.
So, and that requires vulnerability, the willingness to be told what to do, and for a higher purpose. So, do you carry that kind of discipline into your clinic today, like that orderly fashion?
Not so much from like a military perspective, but I think just like I take a lot of pride of just I feel like I represent my ancestors, and just like more immediately like my father and my grandparents. And if I imagine, would they be proud over my choices right now? And am I carrying myself that would make them look good because you're a reflection on them? And, so that kind of goes through my mind on a fairly regular basis of like, am I doing something that's in alignment with that? Would they be proud of my choices? Would they be proud of how I'm, conducting myself and that sort of thing?
And I can tell, the energy level that you bring at the BNI meetings, for example, you always exude this beautiful, positive energy and radiate to the members. Of course, also, you carry yourself well, very professional, you shave, so that's all part of the morning routine. Do you have a morning routine?
Yeah, sure. First, wake up, early, and then cold exposure.
You do that? Wow.
And I'd say I love it.
Not the cold plunge, not talking about getting into the ice. Talking about
if I had one, but just, ice cold shower, just dive in. It's horrible this time of year. You never want to do it, but you force yourself. It's like that, the discipline portion of it. It's like, I know I don't want to, but how am I going to feel afterwards? So it's, so if anything, it just gives you like a tick box to, an early morning win.
So you're shocking the nervous system by doing that temporarily?
Yeah, and I prescribe to like Wim Hof's like cold exposure and like with breathing techniques. And I think there's a lot of value in that with how it, one, shocks your system, and so immune health wise, dopamine neurotransmitter health, and so a lot of benefits from it. But and also just from the discipline thing, and that check mark, like, okay, I did good this morning.
I can see it as obviously a self-inflicted level of stress, and it's in what I call an inoculated stress. It's just it's temporary, it's time, it's infrequent, but it makes you feel great. There is an actual positive response from your body. And then what else you do? You get ready for the day, you have breakfast.
Yeah, I've been doing intermittent fasting for years, so I usually don't take breakfast. But I'll do, a lot of like if I'm catching up on get myself situated for the day. How does my calendar lined up, and a lot of times I want to have that planned out the night before, so I know what I'm, if there's anything that needs to be done, then let's do it then, and then be proactive. But then just setting up the course of the day. Get into practice, and then get things going so you feel refreshed and ready to go, and
nice.
and all that.
And do you do meal prep? Some people do, they one day of the week you just cook your rice, cook your veggies, cook your chicken.
Yeah, absolutely. I really enjoy cooking. So this past week I did like a salmon with a lemon cream sauce, which is I really enjoy, and then also this like Moroccan style chicken. So it's like just having that. So I enjoy that. It's like that. It's fun for me to cook. So having that, and then just having enough on hand where you can, sustain yourself throughout the week.
Just like a bodybuilder, you bring your own Tupperware to work?
Well, a lot of times I could do that. And then sometimes I'll network or meet up with, colleagues or friends during lunch, at which time, but even when you're talking about you want something fast, it's like, what are some healthy choices like sushi or something like that, or crushed red, for healthy options. So there's always like, if you need something quick, there's always like those healthier options. You don't have to go to like those McDonald's.
Do you use supplements like whey protein or any others, creatine?
Yeah, sure. It's I don't go heavy with the protein as much as I used to with and you talk to 10 nutritionists, you're going to get 10 different opinions on like what you're going to do.
Yes.
But me personally, I really like creatine, omega-3 fish oils from a good quality source, multivitamin, vitamin D, and then so those are like the foundational things that I'll stick with, and then I can it's always fun to experiment a little bit. Do I want to do more with this? Boost my adrenals or thyroid health or whatnot. So I'll kind of like sprinkle that in, but the foundational stuff I'll try to keep.
That's great information. I think that knowledge is power. I think that nowadays we live in a time in human history where we have so much information available at the click of a fingertip that it's almost impossible to fail. If you put your mind and attention to something, you will find you no longer have to go to the priest of the village to obtain your level of truth. But you can inform yourself, and you don't even need a university degree to conduct a semi-healthy lifestyle.
Sure.
Right. Do you agree with that?
Yeah, I think there's an abundance of information.
AI and all that.
Absolutely, yeah. I mean, ask ChatGPT what, put up a healthy foundational framework for me to do over this. And I'm sure it'll spit it out within a couple seconds. But, so I don't think it's like the lack of knowledge necessarily. It's like implementing it that people need to really. And I think once you try to do it all at once, it becomes overwhelming. So just doing one step at a time, and that's one teaching patients things. It's like, all right, one thing at a time. Get good at this, and we'll add on to it. So
very interesting. Now let's switch to something deeply personal. It's about faith, character, and inner life. This is also another portion of my Yogaphora Conversations. So I'm a man of faith myself, but I kind of stepped away a little bit from Catholicism and Christianity, and I started to explore several different frameworks, starting with Deepak Chopra, and then Carolyn Myss, and then last but not least, Dr. David Hawkins, the author of Power versus Force. So in growing up in Sweden, was faith important in your life, and it's still important today?
Yeah, and I don't think so much like because we were in Sweden. There, it's common to be like a Protestant or Lutheranism is like the most predominant faith there. But I was like the odd man out in school, like one of the few people who went to church with their family. And my father's or my mom's father, my grandfather, was a chaplain in the U.S. Army, so he was a man of faith and was a pastor. And so we grew up just always having that, that faith-based Christian kind of upbringing. So we would go every Sunday and, have that kind of lifestyle. And I have good memories of that, beautiful churches in Sweden too. In Stockholm.
Of course. I've never been, but I wish I could see it.
Yeah. So, but even in Italy, beautiful churches.
Oh, yeah.
And then we chatted earlier, like going to Malta there. Oh. Absolutely beautiful basilicas and just cathedral. It was mind-blowing. That was really, really nice to see.
Cool. So my question to you, I see how amazingly excited you are to to pursue your career and a successful career and serving as many people as you can. We can never run out of people to serve. We got 8 billion people on planet Earth, right?
Yeah.
So do you see your work as a form of service?
I do. Yeah, absolutely. And I think it goes back
So
to
when I say service, I mean to a higher power that loves us.
yeah, I think so. It's like, how do I phrase this too? With my grandfather, who was the dentist, who was just saying with, if you're doing something for people, I think that's like your social responsibility too. And maybe outside of even faith is just your social responsibility to contribute more to the world than what you're taking. So are you giving to your community? Are you giving to those people? And I think ultimately, yeah, from a faith-based perspective, you act in accordance with me with Christianity. Yeah, you want to like be as congruent with that as possible.
Yeah.
Do I necessarily think that I'm working from that aspect with every adjustment? I wouldn't say not necessarily. But well, I guess I know I'm doing good by doing, but I don't think I'm acting as a Christian necessarily by doing the work. I think that would be unfair for me to take credit for that portion of the piece as acting as a.
But you operate out of certain values, the value of honesty, the value of integrity, the value of wanting to genuinely help,
absolutely,
the value of good faith practice, right? So that's what I mean by
and I think that's
faith as a reflection of your of the quality of your profession.
I understand. No, absolutely. I think that just like outside of even profession, it's just like how you hold yourself in general.
Yes.
With like how you treat human beings and everyone. So I think absolutely. So yeah, if we're going to put I think everything that I'm doing, it goes through that filter.
Wonderful. Do you have mentors? Who mentors you spiritually or professionally? Tell me about your mentors, both spiritually and professionally.
Well, I think both was my father. He passed away this past year, but he was a big mentor to me.
How old was he?
He was 65, so it happened very suddenly. But so he was a great mentor to me throughout my whole life, and even professionally, it was really nice because he was a professor of mine for 5 courses at Logan. He was one of the head professors there, so that was very special for me to have that bond with him. And I always thought so highly of him, just intellectual person, but also very kind and humble. And he was very faith-based too. So it was very nice to just have that. I don't know. I could always go to him with like whether it was an emotional issue or just like talk to him as a human being. And
I think we all need that, of course.
Yeah.
And do you have like books in your house that you reread sometimes, other than just the Bible or whatever?
No, absolutely. It's I like a lot of self-help or like self expansion books. Yeah. So Paulo Coelho, I enjoy.
Name a book. What's your go-to book?
Well, one the Häxan from Portobello. So it was translated into Swedish, and it was one I saw at the airport that I had. So it was the Witch from Portobello. Was one of his.
Witch from Portobello. Interesting.
Never heard Paulo Coelho. And then the not the Pilgrimage. What's the Alchemist?
The Alchemist.
That's a good one.
Yes.
But no, I think what I'm reading right now is a lot of like art books right now. So anytime I have like free time, just diving into more of like the Impressionist period.
Yes.
And even
yes. And we have the art museum in St. Louis. There's so much to be explored, so much beauty, so much incredible stuff. I'm often amazed by what a human mind can create constantly beyond AI. I mean, I'm amazed with what AI can do these days, but I am inspired by what people could do when AI was not a thing.
Well, that's what makes it so beautiful too, is knowing that someone had to do that with their hand, with their own inspiration.
Yes. Yeah. Couple of things, have you faced moments of doubt in your career, and what carried you through? Have you ever doubted, you wanted to do something else? You wanted to become something else other than a chiropractor?
Yeah, I mean, it's early on, the first couple of years was definitely challenging because it's, people aren't just going to show up at your doorstep. It was very challenging, but, it's a lot of grinding. I would do personal training on the evenings, on the weekends. I would work for another clinic on weekends. And there were several times where I was just thinking, this is a lot of work. It's not going as fast as I would like. Did I make the right choice? And a lot of my life, I spent, which country should I live in? Mm-hmm. And it was a lot of internal dilemmas with that. So now I feel very fortunate, feeling at peace with that, and just doesn't matter where you're at, really. And everyone's always asking, do you want to be in Sweden? Do you want to be here? I'm just happy being a human being wherever I'm at. But yeah, there was a lot of doubt for sure, when a lot of challenges. So
you're in a great location. You're in Creve Coeur, Missouri. So it's a nice, affluent community for sure.
Yeah.
In fact, the next subject of our conversation is about business, time, and responsibilities. Now we are both, entrepreneurs, meaning that you have to, just like we said, the first couple of years, you don't have people showing up at your door. You have to get your name out there. You have to market yourself. You have to be essentially make some time and money investments for your name to be known. You also are a BNI member, so there is costs involved to that as well. And so there is also a level of entrepreneurial mindset that needs to be in place and things to implement. When I was in Colorado, I was fascinated by looking at other chiropractors marketing themselves. They were planning this dinners with Doc. Have you ever seen that? I'm sure in your field. They will pay for expensive dinners like a steakhouse, and they will invite an unlimited amount of people, like 50, 100 people, spend a whole lot of money on having an opportunity to be seen so that they could do their 20, 30-minute speech in front of a new crowd. But that was a huge investment of money just for a 40-minute talk.
Sure.
So tell me about that. Tell me about how your marketing strategy has been and the value in it and how happy you are with it.
Yeah. No, it's funny you bring that up. I haven't thought about that in a while, but that was really popular when I got out of school, that people were doing that a lot with the dinner with Dog. And I've done everything from, making door knockers and just hundreds of them around, the Creve Coeur area, just letting them know I was there when I first opened up.
There was no Facebook at the time. There was no Instagram. There was no...
Oh yeah, this wasn't 30 years ago. This was
okay.
No, this was in 2015.
Oh, okay.
Where I graduated, and then but I didn't do much with promoting myself on social media at the time. I've hired so many marketing companies with high expectations or high with the optimism that it's going to lead to something, but inevitably it doesn't meet my expectations, and it's more of what's the return on investment, and I'd be happy if it just cut even at that point. But so there are a lot of marketing companies that do make it sound very easy to get business that way. But I think the strongest thing is just sustaining myself in business, and now my name's been recognized, and there's a lot of referrals and that sort of thing. So I'm grateful that I've positioned myself that way, and there's that brand awareness, people know about me, and then that trust. So that goes a long way.
It's all about trust. And people buy people before they buy their product or service. That's one of my always my big phrases that I've heard and I repeat. Now let's talk about your relationship with money. Money as a universal medium of exchange to measure perceived value. Right?
Sure.
2,000 years ago, we used the bartering system, the goats and chickens. And that's how we solved the goats and chicken problem, right?
Yeah, sure.
So how do you see, what is your relationship? How do you see money? Because I do have some framework around it through mentors and people I've heard in YouTube. They say that wealth is nothing more than the perception of abundance triggered by gratitude, and poverty is nothing more than the perception of poverty. The perception of scarcity that is triggered by fear.
Right.
So ultimately, what we're after is a feeling. So in your case, what is your relationship with money? I don't know how much money you have in your bank account, and I don't want to know, but tell me.
Sure, no, I understand. No, I think for me, it gives you that a basic safety net of security, because I've been in those areas in my life where I didn't have that, and it's very scary and it's very threatening. And now knowing how strong of an emotion that was to be in that situation, I avoid putting myself in that spot. But now, so after that, it provides opportunities for you, and on those those little fortune cookie sayings that you get on the tea.
Those strips, yes.
Yeah, but it was on a tea thing. Anyway, it said one who. I'm going to mess it up, but it was one who knows how to enjoy life doesn't need riches or something along those lines. But you get the point. It's if you know how to live life and really just be appreciative. My mom's a great example of this, just being so appreciative, and it's so inspiring that you don't need this grandiose a lifestyle to be happy.
Right.
But I think money does give you the opportunity for travel, such an important thing for me. And then interests like scuba diving or sailing. So, I mean, does it give you the opportunity to live a lifestyle of things that you want to do? Of course, money does, play a role with that for sure.
Sure. Because, one thing is living out of a situation of survival, having your survival needs met, which are food in your fridge and a roof on top of your head, which are not guaranteed by anybody, especially in this country. It's a meritocratic kind of society, or the model is that you get paid in relationship to the amount of value you add to the marketplace, right? Little money, little value, little money. More value, more money. You can charge rates as a chiropractor because of the perceived value that the marketplace has established. Same with me. I charge an hourly rate for massage. So it's all in relationship to the perceived value. But like you said your grandma was talking about, connecting to gratitude, connecting to the feeling of abundance. That's what makes the real deal. That's what that's the real inner achievement that we're looking for.
Yeah.
Good. All right. So cool. Tell me about, opening your own clinic. You said that you first worked for worked for somebody else for a little bit.
No, I always worked for myself, but I would rent out space from another clinic in a physical therapy office. So, it was a nice symbiotic relationship that we could refer patients back and forth and so forth. But it still took time to build up your own client base and all that.
That's right. And how do you balance your own self-care with running a business? I mean, there's a lot to do. You use technology, of course.
Yeah, I mean, there's a lot of hats that you need to wear running a business for sure, and it can be overwhelming. But I think you have to kind of take a step back, and I always even think about this today. It was a kind of, if it feels overwhelming, almost I learned to laugh at the situation a bit. It's are you taking this a little too seriously?
Right.
It's so some things are serious, but are you taking it too seriously? So it's you're healthy, things could be way worse than what they are. So it's just be grateful for what you're doing, but then also balanced, these things we talked about earlier, sleep, stress management, going to the gym, what are you eating right? But those thoughts too, the quality of your thoughts, are you you have to keep that in check too.
Yes.
What's that internal dialogue like?
Internal dialogue, of course. I'm glad you mentioned humor, being able to laugh at the situation sometimes. My mentor, Dr. Hawkins, says that humor itself is of divine origin. And it essentially transcends the lower levels of negativity by recontextualizing reality and reframe it in a way that is that exposes the unspoken human fallacies. Right? When you make a joke about something, when you essentially de-dramatize what otherwise would be unapproachable. You're creating a different energy field around the situation, That's why humor is so powerful, right? So,
That's interesting.
yes. Now let's talk about your, I wanted to know, what do you want patients to feel when they leave your office?
I want them to feel that they had my undivided attention, that I listened to them, that they felt addressed, they got value out of their time with me.
Yeah.
And I want that to be a state change. If they came in, a certain, I want their internal state to be elevated more than what they came in with.
Yes.
So it's, a pattern interrupt for what they were experiencing.
That's wonderful. That's exactly the same feeling, that satisfaction I do have, regardless of the transaction. And what kind of culture are you trying to build, if any?
Yeah, I think a culture of, appreciating life. It seems I guess maybe too generic, but we're given this body, and if you're not able to do the things that you'd like to do, it's it's just a lower quality of life.
Right.
So yes. I think that appreciation for we can do more than what we maybe these internal limitations that we put ourselves in. So just push it. If you want to do something that sounds inspiring, then maybe start considering that. Yep. Doesn't mean you have to rewrite your whole life, but just start introducing some kind of optimism and diversity in your lifestyle.
Yes. And I think that most people, including myself sometimes, don't oil the garden gates until they start squeaking, right? Because, we're all born with health. It's the unhealthy things that we do over time that lead to a position of unhealthiness or disease, right? Yeah. So refining the balance only takes a few very simple steps, steps that we already know how to do. We just don't do what we know. Drink more water, get more sleep, turn off the TV, turn off the computer or the phone before scrolling and getting into the Facebook or Instagram world, which sometimes is just a characterization of the life we wished we lived, but it's just the storefront. I think there's more to life than what we are actually able to see, and there's more to life than just doubling up your cheeseburger. Sure. So there's that. I think that we have so much work to do in our fields, and I'm so glad that you're here today. So let's talk about your legacy. Just a couple more questions. Let's see. What dreams are still ahead of you?
I think taking on a partner or an associate to have maybe take a step back from the clinic is the eventual spot I'm going to position myself in, and then teach them and make it maybe an easier way for them. But I think at the same time it's there's a lot of pride you get from building something from the ground up. But if someone is interested in taking over my practice or just introducing them to this into this field, I'd be happy to kind of pass the torch on.
Yes, yeah, that will be wonderful. Let me ask you, would you ever return to Sweden professionally one day? I often think, would I retire in Italy or would I stay here? I mean, obviously it's projection into the future, but
right. No, I've met with a couple of years ago. I met with the Olympic Committee over in Sweden about working on their athletes. But ultimately, and I met with other chiropractors in Sweden, and there would be a lot of hoops to jump through. Even though I'm trained and board certified in the U.S. and am a Swedish citizen, you would still have to go do a year's unpaid internship to work and get the license in Sweden, which is a huge thing to jump through. So that doesn't sound so appealing. But I did look into the UK or Australia. I think it's even easier to practice in Italy than what it would be. It would be quicker for me to become a chiropractor in Italy than it would be in Sweden.
Okay.
So.
Well, we often say that the grass always looks greener onto the other side, right? As an Italian, I always looked up to the U.S. as the bright lights of the United States, and I always felt that would have been such a step up. And when I go back to Italy, they call me, oh, the Americano, Andrea the Americano, because I had an opportunity that most people didn't have to spend a good portion of life into another country.
Right.
So it's all a matter of subjective perception of whatever value we're trying to sell. But it's interesting.
Yeah.
So last but not least, if you want to give an advice to your younger self today, what would that be?
Don't take things so seriously. And just like have faith that it's going to be okay. It's not going to be easy at times, but don't just have faith. Don't be so like scared of life or like any hardships that you're dealing with. You will survive them, and just like calm. It's going to be all right.
Yes, my mentor, Dr. Hawkins, often says that the ultimate fear that we all have is the fear of physical death, right? If you can manage to transcend that fear, that primary fear, all the other secondary or even lower fears will eventually collapse. All the stack of other fears can collapse when you're inspired by the energy field of life itself, which is self-renewing. Creation is ongoing and continuous. Because of the gracious of divinity, of course, or the infinite field, which is beyond time and place. Then we can step into the field of infinite abundance and opportunities, right? Like we said earlier, we're never going to run out of people to serve. Right, even if it's in the most humble way, just having a talk, volunteering, and just shaking hands or showing up with presence. It's an act of service for sure. So thank you so much, and it was great to have you here today. I think having you as a guest has been an honor.
It's always fun to see you.
Yes, I appreciate it, and. So for those watching who would like to connect with the Dr. Chris de Geer, you can find him at drdegeer.com. His address is 456 North New Balance Road, Suite 103, Creve Coeur, Missouri. Phone number is 314-681-2800. Again, 314-681-2800. And his email is health@drdegeer.com. His clinic, the Geer Health and Wellness, serves individuals ranging from everyday patients to athletes and those recovering from injury with an evidence-based and whole person approach. To our viewers, this has been another episode of Yogaphora Conversations, long form, unedited, and rooted in real thinking. If you found value in today's discussion, please like, subscribe, and share with someone who cares deeply about health, performance, and living pain-free with intention. My name is Andrea Spadafora, licensed massage therapist, board certified in therapeutic massage and body work, registered yoga instructor, 200 level, and founder of Yogaphora LLC. And today we've been in conversation with Dr. de Geer, DC, MS, CCNCS.
Too many.
Not too many. Thank you so much for joining us.
My pleasure.
Until next time.
Thank you.
Arrivederci.